Good afternoon, everyone, and thank you for joining us for Valley Children's latest installment of our virtual health series for families. I'm Zara Arboleta, reporting to you live from my house in this new normal, joined by Dr. Hailey Nelson. Dr. Nelson, good morning to you, or good afternoon. See? Time means nothing nowadays, apparently, but no. Dr. Nelson, thank you for joining us.
Thank you so much for having me today.
All right, for those of you watching at home on Facebook, feel free to send questions to Dr. Nelson in the comments. You can also do so via Twitter as well as Instagram. Dr. Nelson is one of our complex care pediatricians who sees patients in our Charlie Mitchell Children's Center on the Valley Children's Campus in Madera. Here to talk about COVID-19, flu, allergies, I think a hodgepodge of everything, right, Dr. Nelson?
We'll talk about it all. Just like at Charlie Mitchell, we care for anything and everything. I will answer your questions today.
So I think the thing that is first and foremost on a lot of parents' minds, I don't think I know because we're getting all these questions coming in through social media, is the impact of the wildfires on air quality, and then that in turn, how it impacts our kids. Anything you want to start off with addressing the concern for respiratory problems right now with the air quality index, just at very unhealthy levels?
Our air right now is so bad, and looking at the meter as it goes from the green to the yellow to red, and now we're over in purple and hazardous, like, please be careful, stay home. So if you see that those numbers are high, that's not the time to go outside with your child. I know that people who don't even have asthma or allergies are still really feeling it with just how much pollution is in our air right now. And then if your child does have asthma, allergies, is sensitive at all, really staying on top of their maintenance medications, giving them those as scheduled so that we can hopefully prevent asthma exacerbations and other issues from all of this.
The other big concern is the symptoms of COVID-19 and the symptoms of asthma and allergies and your reaction to smoke are very similar. You mind breaking down for families who might be a little worried about being able to tell the difference between, okay, this is just because of air pollution and this could be because of something more serious?
Yeah, so you're looking for some of those other signs and symptoms as well. Does your child have a fever? One of the things that COVID does that other infections or illnesses don't is that loss of taste and smell. So if your child can't smell the wildfires and you can, that's a nice indicator that, hey, there's something else possibly going on. But there is a lot of overlap in terms of the respiratory symptoms. So it can be somewhat difficult to tell. COVID, in addition, can have GI symptoms. And so some children have diarrhea, can have rashes. So there's things and other body organ systems that are involved besides the respiratory tract. So if your child's having any symptoms at all, it can be challenging to sort it out. And that's why we really want you to call your doctor. That's what I'm here for.
There are people who are saying, if my child starts experiencing symptoms, should I go straight to the emergency department?
No, please don't. That's what I'm here for. I'm like, here's my setup. So Charlie Mitchell patients, they know they get to see my office. I move stuffed animals around and try to make it interesting for my patients. But really, that's your primary care doctor is your first phone call, and then we'll help you figure it out. Certainly, if your child is in respiratory distress, I'm going to send you to the emergency room or maybe even have you call an ambulance. But if your child is having mild symptoms and I can help you out over telemedicine or potentially direct you into clinic, that of course is what we want to do so that we can save the emergency room for those true emergencies and those situations where those patients have to be seen over there. The rest of it, I'm happy to manage.
So there have been lots of questions from many Valley Children's families asking if Valley Children's is starting to cut back on procedures, surgeries, those types of things. And as of right now, no, everything is still on schedule. But you and I were talking before this started about potentially switching some families to telehealth if they can be seen through a phone or an app, right?
Yep. So we have a secure app that we use that's then HIPAA compliant so that your visit is safe and protected when you're able to see me via telemedicine. So if your child has an upcoming appointment and you don't feel safe going out because of the air quality, call your doctor's office and see if that's an option to switch over. There are times where I need to see your child in clinic, and so we have to discuss whether or not it's something that can wait because of the poor air, or if they really do still need to come in. And so we're trying to weigh out the risks and benefits. We don't want people to find fall behind on their vaccines. And so trying to stay on top of that, but of course, giving everyone a little bit of grace right now, because in addition to a pandemic, we're dealing with wildfires and just unprecedented horrible air quality. So we're trying to do our best to deal with it on a case-by-case basis.
So since about February, Dr. Nelson, it literally has been one thing after another. If anyone had said, this is still the place we would be at, back in February, March, if they said we're still in it September, October, we'd be like, no way, no way. But now obviously this is the new norm. And as we are continuing still to adjust, now we're approaching flu season. And so there are lots and lots of questions from worried parents who are saying, okay, first I was worried about COVID. Now I've got to be worried about the flu as well as RSV season. What are some things you want to say just to start off this segment here about COVID-19 and the flu season now?
Oh, I think the big thing that I want to put out there is really a disclaimer. So just as you mentioned that the situation has changed from February to now, that there's constantly new information coming out. So the information I have today is as of, what I've been able to read off of the CDC and everywhere else. So it's up to date today, but that's not to say that things might change. So I'm doing my best to give accurate information today, knowing that it's constantly an evolving process. And so having families know where do you go? So besides talking to your doctor, the Valley Children's, our website has COVID information. So we're keeping that updated for families. We have wildfire information too. So that's a great place, going to the CDC. And then I also really enjoy healthychildren.org from the American Academy of Pediatrics, because that's written by pediatricians. So board certified pediatricians are giving advice. And so knowing reliable, trusted sources to go to when you have these questions, because inevitably, I don't know what's happening in the next month. I've given up on trying to guess. So just knowing kind of where to go.
So there have been several questions. We've been soliciting questions for the last week or so. So several worried parents were saying, are you as a physician worried about the flu season being even worse because of COVID-19?
Yeah, so I'm worried about the flu season because COVID's not nice. This is a mean virus that we still are trying to figure out. And there's nothing to say that you can't have the flu and COVID at the same time. So the best thing I can do is to encourage all of our families to vaccinate against the flu. Like I have a flu vaccine available. And if I can help prevent illness like that, that's my goal as a doctor. I want to keep kids healthy. And so I'm trying to do the preventative measures now to make winter hopefully not be as bad as what possibly is being predicted, although we don't have a crystal ball. So we don't know how, bad things might get this winter, but let's go ahead and just eliminate flu as an option. So getting your flu vaccine early and then continuing to do the other measures that we're doing for COVID, the hand washing, the wearing your mask, the social distancing, all of those things help with all germs. They're, it's just good advice in general. So that can hopefully help us keep, flu numbers down and at some point get our COVID numbers down so that we can reopen things more and, someday get kids back to school. And you've got your kids distance learning. My kids are, at home, they've got their Zoom sessions. Like someday, wouldn't it be nice to be able to get them back where, they enjoy learning too. So trying to balance it all out.
So your recommendation then is for everyone, no matter what, to get a flu shot.
Everyone over the age of 6 months. So the flu vaccine, you can start giving it as young as 6 months and then up. Get your flu shot and get it early. So the goal would be for everyone, getting those flu shots in the month of October, really before flu hits hard in Fresno. Because although it will be helpful to get your flu shot later, you want to protect yourself before the flu gets here. So that's what we're trying to do.
So there is one mom who sent us a question via Instagram who was worried about getting the vaccine too early because she was saying, if I go too early, is it going to protect me throughout the whole season? So when is the best time to take it so that it doesn't, I don't know if expire is the right word, but lose its efficacy before flu season's even over?
Right. And I've gotten that question too. So people worry that maybe it only will last so long and then it's going to start to wear off. They haven't shown data yet to say we need a booster halfway through flu season. So get your flu shot. They're available now at most pharmacies. I know at Charlie Mitchell, I keep looking. I'm like a little kid waiting for the mail. Like they come in the mail. I'm waiting for them to come and then we'll be giving them out. So as soon as it's available for you, I say go and get it. And that's going to be your best bet for protection.
Someone asks, what strains of influenza does this year's flu shot protect us from?
All right. So the flu vaccine has a total of 4 strains in it. There's flu A, and there's 2 different types of that, and then flu B. And those are based off of predictions. So they update the flu shots and change the strains based on the performance last year and what's predicted for this year. So that's, if you hear about a quadrivalent, quadra's 4. So that's the 4 strains that are covered in the flu shot.
So one of the biggest criticisms from people who don't want to get flu shots is I could get the flu shots and I'm still going to get the flu. But there's an important distinction here about what the flu shot does. Do you mind explaining that to people who are watching at home right now or at work?
Yeah. So valid concern. I get that question a lot as well yeah, but then I could still get sick. The flu shot's not great. Well, no, the flu shot some years is better than the others. And so it's the best prediction that we have. It's available, and we're trying to, again, help keep kids healthy. What the flu shot's going to do, though, is that if you did get influenza and you've been vaccinated, and you unfortunately do have symptoms, they will be mild. So it'll be not nearly as bad as if you weren't vaccinated, and it will prevent hospitalization. So if you're thinking about, hey, my kid got the flu shot, they got the flu, they were maybe home, they watched some extra Paw Patrol and laid around on the couch, and then they were okay, as opposed to needing to come in and be hospitalized and have serious kind of sequelae from it. So some people end up with pneumonias and other issues from influenza.
I remember I spoke one time with Dr. Karen Dahl, who is the head of quality and patient safety. And she was telling me that when she looks at data from previous years, all of the very serious cases of influenza that required hospitalization at Valley Children's, the vast majority of those kids with the flu were children who did not get the flu vaccine.
Mm-hmm.
So like you were saying, again, it might not protect you 100% from getting the flu, but at least if you are vaccinated and you get the flu, then you're saying the chances of having to come see us at the hospital are a lot smaller.
Yeah, your chances are a lot smaller. And coming into the hospital right now, there's extra barriers and things as well that I know families are nervous about. So families have been nervous just to come to the emergency room because you only get one parent per child. And there's a good reason for that. We're trying to reduce the number of people here and your exposures. And so if your child is hospitalized, whether it's COVID, whether it's flu, whether it's anything else, know that we're not taking your kid away from you. One parent will be able to be with your child, but you won't be able to have that same stream of in-person support. So you won't be able to have extra visitors coming in, and you'll have to rely on other ways to connect with your family members, similar to what we've been doing a little bit at home with, FaceTiming, things like that. But it really does feel different right now than previously when you had a child who was sick.
So that brings up that's a great segue into this next question. One parent was asking, we're home all the time. No one visits us. We're pretty much in lockdown mode. Why do I need a flu shot and why does my family need one if we're really not in contact with anyone else? That question just came in.
So, and my family's been on lockdown too. So my kiddos really haven't left. But at some point you get groceries or you don't even think about some of those other contacts. There's places where, despite our best efforts to stay home, we might come in contact with this virus. And if it's something that we can prevent so that you're not at home with a fever, now wondering, oh, do I have COVID? Do I have the flu? And kind of going through that mental game and that stress and anxiety, or then you don't get sick because you got your flu shot. That'd be even a better situation. So there's lots of benefits to getting the flu shot, and there's not really any downsides.
A parent of a preschooler is asking, do you recommend the nasal spray or the shot? Do they still do the nasal sprays?
So the nasal spray kind of fell out of practice a while back, and the shot was shown to be a little bit more protective. So that's what we've ordered here for Charlie Mitchell Clinic, is that we'll have the injection this year.
Okay, another question someone asks, my child tested positive for influenza B in February. Could she possibly have had COVID-19 as well?
Yeah, so if your child had a documented test for influenza B and was positive, it's very unlikely that they also had COVID. And we know, looking at the numbers for kind of Fresno and Madera, that COVID wasn't really here yet, but that flu was still at its peak. So the flu season last year kind of started in October, and then we hit another peak in February. So we were seeing high numbers of flu. And I know that brought up a lot of questions for families who were kind of hoping to get COVID out of the way. Like, well, maybe I just had it and then we can be over this and not have to worry. And that's unfortunately not true. So sorry, still get your flu shot. And I'm sorry your child was sick last year, but hopefully this winter will go better.
All right, for those of you just tuning in, I'm here with Dr. Hailey Nelson, who's a pediatrician in our Charlie Mitchell Children's Center at Valley Children's. Taking your questions right now on Facebook, Instagram, and Twitter, so keep them coming. Let's see, someone wants to ask, someone's saying, when will Charlie Mitchell Children's Center have their flu shots available? But you're saying they're
day. Yeah, so they're not here yet. I keep checking the mail. Any day we will have them available. And then the way that it works at Charlie Mitchell Clinic is that we schedule nurse visits. So we'll fill up that nurse schedule and get kids in as fast as we can to be able to give them out once we have them.
Another question lots of people are asking, how can we tell COVID-19 apart from the flu?
So COVID-19 and the flu do have a lot of overlapping symptoms. So the fatigue, the runny nose, coughing, some of those things are similar with both cases. Something that's unique to COVID that you won't see with the flu is that loss of taste and smell. So if you've talked to someone who's had COVID, they're like, man, I couldn't smell anything. And right now we've got a great test outside, which is the horrible air. So smelling the wildfire tells me, okay, well, you don't have COVID right now, most likely. So not a guarantee, and not everyone has the same symptoms, but those are just some of the similarities and differences.
And then someone else asks, is there a combination or swab test to detect flu and COVID-19 at the same time?
So there are combination tests. There's also individual tests, and it's just a matter of where you're going to get tested, which one might be available. So there was a quick rush to get things to market to be able to detect what illnesses we have going around. So right now we have the 2 separate tests available here through Charlie Mitchell Clinic.
Do you mind explaining for families how a COVID-19 test is administered because right now Valley Children's is testing anyone coming in for inpatient admission, anyone coming in for surgeries or procedures. And lots of parents are worried about getting it themselves, let alone their child. I wondered if maybe explaining it a bit more for them would help ease their worries a little bit. Although it's not, you and I have both done it. It's not the most pleasant experience, but.
Yeah, so the test that we have, and in order to get the best accurate response based on that test, is you really need a nasopharyngeal swap, which means that Q-tip is going in your nose back where, people have said, oh, it feels like they biopsied my brain. Like it has to go all the way back in your nasopharynx. And for little kids, I've explained it, like for my daughter, when she had to be tested, it's that feeling when you jump in the swimming pool and you get water up your nose and you're like, oh, that doesn't feel good. And so it's something up your nose. It doesn't feel good. It doesn't last long. So it's a brief test, but you really want to get a swab back there to be able to, if we're going through this hassle, I want to know that I have an accurate swab so that we can rely on those results, because there's still a risk of, if you get an inaccurate test and you said that someone's negative and they truly are positive, like that could potentially be an issue where then they continue to spread or something else. And so the NP swab, although not fun, is the way that the test is currently done.
And like you said, it's only uncomfortable for seconds and then it's over.
But I think going back to that a little bit, I think being realistic and talking to your child so that they know what's going to happen. So talking to your child about the test beforehand and kind of having a plan of, okay, do you want mom to hold your hands? Like, how can we get through this together? Maybe helping them take a deep breath. Do they want to even just close their eyes? I'm like, you just sit there in your car seat. I'm going to hold your hands. You close your eyes. We're going to count, to 5 and it will be over, like whatever you need to do. But I think there is a part of the parent coaching that can really make it less stressful for the child.
A question that came in through Facebook: can you get COVID-19 more than once?
Yeah, so that's a great question that lots of people were hopeful that let's just get it over with. Like, if I had COVID, I don't have to worry anymore. And it's not true. We've seen where there's that immune response and then it wanes back off. And so there have been studies that I've seen where someone develops new symptoms consistent with COVID infection, even though they had a previous documented infection. So it's concerning, and that's really where we need to keep our guard up. So I talk about keeping that guard up with it, and repeating the hand washing, wearing our masks, stay 6 feet away. And so the more that we can do that to help, protect our families, the better.
And who should be wearing masks? Parents always want to know, how can a young child wear a mask? Can my preschooler wear a mask? What are some recommendations you want to give? Because obviously your Valley Children's has taken the stance, all adults should be wearing a mask. But how about for kids?
So we really want kids to wear a mask, but I know that it is a skill. And so that's really where parents need to start helping their children. Over the age of 2, it is recommended that children start wearing masks. And the first time you stick a mask on your child, they're not going to just like leave it on and go about their day. Like they're going to take it off. It's going to be below their nose. So practicing that mask wearing, having it cover your mouth and nose. One of the things that I did for my daughter, so I borrowed her teddy bear, is, that we practice. So we have our little puppy dog that has its mask on, and then she gets to put her mask on. And so come up with ways that you can play with your child, that you can start to practice this now so that they get used to it. The other thing is that you might have to, puppy dog fell down. Hold on to it for a second. That you might have to actually buy a couple different masks. So don't just think that you're going to buy one mask and that's the one that your child will wear. Just like how they can be particular about their socks or anything else that your child wears, the mask might rub their face wrong or bother them. And so finding one that they like that feels comfortable so that they feel like they can breathe. I know people have complained, but then I won't have oxygen or I'm rebreathing carbon dioxide. Like masks do not decrease your oxygen level. You are not breathing in carbon dioxide. Surgeons wear masks all day while operating, and they are smart people. So this is not going to hurt you, but it is something that because it's something new for you that we've just got to practice.
A few segments ago, Dr. Horspool, the medical director of Charlie Mitchell, had done one of these virtual health series with us. And he was so funny because he said, I've been at Valley Children's a very long time, and not once has a surgeon passed out from lack of oxygen during a surgery because he or she was wearing a mask. So you'll be fine.
There you go. Yeah.
He was very clear about that. Someone else is asking, can someone get the flu and COVID-19 at the same time?
Mm-hmm. Yeah, so it is possible to get COVID and the flu, just like it's possible to have multiple viruses at the same time when we're looking at flu and RSV and some of the other players that kind of come into effect in the wintertime. So it's possible, and that's really where that prevention for the flu with the flu vaccine and continuing all our protective measures that we're doing for COVID is going to be helpful for everyone.
Someone else is asking, will immunizing for the flu actually also reduce the risk for complications if I get COVID-19 as well?
That would be a wonderful benefit, although not shown to be helpful against COVID. Immunizing yourself against influenza, just like we were talking about earlier, is going to decrease your risk of hospitalization and serious flu-like illness. And so that's the main point that we're trying to make with getting your flu shot.
One woman wants to know, can expecting moms get the flu vaccine?
Yes. So pregnant moms, that's the best way that you can protect your baby, because the flu shot, your child won't be able to get it until they're 6 months old. So creating that immunity around them. So if you're an expectant mom, it is safe to get the shot while you're pregnant. And then having your partner, the grandparents, anyone else who might be around your baby or anyone who's around your children should be getting their flu shots, as well as for expecting moms. So they recommend the DTaP and the Tdap vaccine. So whooping cough. We want to also make sure that we're getting our other vaccines in as well, so that we're not kind of creating the opportunity for other outbreaks of infections.
A mom writes, I'm breastfeeding my infant. If I got the flu or COVID, is it still safe to nurse my baby? Would I need to pump and dump or wean while I'm sick?
Okay, so that's a really great question and super stressful for our lactating moms. So if you do have an infant that you're breastfeeding and you're sick, but you're worried about your baby, know that while breastfeeding, you are passing off some of your immunity to them. And so that's why we wanted you vaccinated, and you're sharing some of your immune system with them. If you do end up with the flu or COVID, it is still safe to continue to breastfeed. We do recommend that you wear a mask. The hand hygiene is really key there so that we're not sharing more of the respiratory secretions with your baby, but in terms of the breast milk, that you're not passing on flu virus or COVID virus through your breast milk so that it is safe.
Someone's asking, I already know your answer is going to be for this one. I've never had a flu shot before. Is it safe to start now?
Why, yes, come on in and get your flu shot. So there is always an opportunity to get your flu shot every year, and that we encourage people to do it. So if you've never had a flu shot, come on in, that this is the year that you can start, and that it doesn't matter at what age you are, as long as you're over the age of 6 months, that it's safe to begin getting a flu vaccine to help protect yourself.
Another reason people cite for justifying not getting one is something that someone asked too. My family got sick after getting the flu shot once. We haven't done it since then. Should we actually consider it this year? And you must hear that a lot. I got a flu shot. I got sick, I swear.
Mm-hmm. Yeah, so people who get sick after getting their flu shot, it's not from the flu shot. It actually is because it's cold and flu season. So you were already exposed to other germs. When they did a study, so they actually looked at giving people the flu shot or giving them the placebo. So they did saline injections. And the thing that was the same between the two groups was with the flu shot, you complained that your arm hurt. But both groups, whether or not you got the flu shot or you got the saline injection, so you got the placebo, complained about body aches, fatigue, like all of those other things that we hear, even though they didn't get the shot. So it's not caused by the shot. And that the way that I like to look at it instead is that, hey, if you do have a response to the flu vaccine, so say you get it and you do have, some of those crummy feelings, that's a great sign that your immune system is actually responding to that vaccine. So if your immune system is responding, it's building up like a strong, response, and you're better protected for when you do encounter the virus if you happen to come across it later.
One parent asks, my child has an egg allergy. What do you recommend we do to protect them from the flu?
Oh, that's a really good question, and something that comes up for allergy families when we look at some of the ingredients for these vaccines and whether or not it's safe. And the guidance has actually changed. So the 2018-19 year, and then now this year, they are saying that you can get the flu shot even if you have an egg allergy. If your allergy is more than just hives, well, you should get it done in a doctor's office so that someone's watching you in the event that you have anaphylaxis, so that you have a reaction. But it's not listed as a true contraindication. You just are exempt from getting the flu shot. You should just talk to your doctor and then make sure that you're monitored.
Question just came in on Facebook. What if when you're getting a COVID-19 test for your child, they didn't go all the way up your little one's nose, like just the tip of the nose? Can they do that?
So although we can, sometimes it's a swab and a miss. And so, it's all in having a good holder and having that help and being able to get the test. If you test in the mid nose as opposed to all the way back, you're still hopefully going to detect the virus. It's a PCR test. We just need to have enough to be able to see if the virus is there or not. So that test would still get run. You may not be able to completely rely on the results. So if they really feel like they didn't get a good swab, then that's where you need to talk to your doctor about, well, how long should we stay home? And do we just need to presume that we have a COVID-like illness and do the isolation and the quarantine thing anyways?
Someone is asking, do you recommend that we still keep our children at home?
So for right now, in regards to COVID, schools aren't open. Our case numbers, although they are going down, I am, cautiously optimistic if they continue what that might look like for school and things. Right now, we still have a large disease burden, and we've had children hospitalized with COVID. So we know that although it seems to hit adults more than children, and so initially we were saying, hey, kids don't get COVID, it'll be okay. Well, no, some children do. So the best thing we can do is to keep our kids home right now. And then separate from that, we have the wildfires. So even if you wanted to go out, the air is bad and you should keep your child in because we don't want to trigger asthma and breathing issues since our air quality is starting to reach those hazardous zones anyway. So for now, please stay home.
Do you have any advice, not only as a pediatrician, but as a mom, for other parents who might be a bit frazzled right now, trying to juggle working from home, now learning from home? I don't know if you're getting any calls from parents asking how to help their kids cope right now. Anything that you're seeing and that you might want to help families address, because it's not easy doing all this stuff.
This is like the hardest job,
Yeah.
trying to balance all of these things and having your kids do school. And if you're trying to log in for work and they're making noise in the background, and how do you do all of it? And I think one of the things that I remind myself is we've just got to give ourselves a little bit of grace. Like this is unprecedented times, so it's okay to lower those expectations just a smidge. Like, of course, I want my child to do well in math, and of course, I want them to, do all these things. But if we're doing okay, that's actually fine for now. And so being realistic about what your expectations are for yourself and what you are trying to accomplish, as well as for your child. Because I know that it's really been tough. And so hang in there and know that kind of we're in this together, even though we're apart.
Yeah, it's true. So when you are seeing children in clinic, obviously you want to make sure that physically they're taken care of and that they're doing okay. But how important is it also to do check-ins for a child's emotional well-being right now?
Oh, I think it's really important to check in with kids to see how they're handling things and then also what they've internalized. And so it really is having that age appropriate conversation. So what my kindergartner versus my third grader, or even if you had an older child, like how they perceive the situation and what their questions are different than what you and I see based on watching the news or what we're plugged into. And so really being able to meet them at their level and answering those questions for them so that we're not trying to overwhelm them with everything that we know, but like, hey, what is it that what have you seen or what have you overheard from mom and dad? Because you might not think that they're listening, but they are. So really being able to talk to them and provide them with reassurance. And that's one of the big things that I feel like I do in clinic when I'm doing well child checkups is talking to kids and having them tell me how far away we should stay from people. How long do we wash our hands? Like I ask those questions and they tell me back and I'm like, awesome. See, you're doing a great job. And so empowering kids to know how they can help because the situation sometimes feels very helpless.
Mm-hmm. So we are getting lots of people commenting. We love you, Dr. Nelson. We love Dr. Nelson. So all your fans are watching you right now, Dr. Nelson.
Hi, friends.
Someone is asking, what are your thoughts about getting a COVID vaccine when it does become available, citing the fact that it has been developed so quickly?
Right. There has been an amazing rush to come up with a vaccine for COVID, partially because COVID kind of brought everything to a screeching halt. And so how do we get back to, we talk about this new normal, like how do we get back to life without that vaccine? It's interesting to see where those trials are at now. And then as the competing companies are doing their safety checks and things like that. What I want to reassure families is that by the time there's a vaccine that I am offering in clinic, trust that I would not offer something to your child that I wouldn't also be willing to give to my own children or get for myself. And so, yes, there are vaccines out there. It's by no means ready to be given or something that we're ordering yet, but that we're, keeping an eye on it because, of course, it'd be nice to have, but it's not something that we would give until there's good data showing that it is helpful for children.
Okay. Someone just said, thank you for mentioning that we need to give each other grace. And then someone else commented, also self-care is important right now too.
Yeah. Self-care goes a long way and it can be something just small. And so not only it's like, of course, parent self-care. And so trying to find those like little mommy breaks and what I can do just to recharge. So if you feel like you are being short with your children, like it's okay for mom to go take a timeout. Like it's okay for your kids to have a little extra screen time. Pediatricians, we harp on, limiting screen time and like outside play. I'm like, okay, now that's switched. I don't want you outside. It's okay to watch a little more screens. Babies use some screen time that also involves movement. And so I've been, trying to push that. But if you want to let your child do some Go Noodle or some Cosmic Kids yoga or something, and you take a break and can kind of calm yourself down, that's okay too.
What are those sites you just mentioned? We're going to have to share those in the comments
Yeah.
section.
So Go Noodle, which is one of the ones that a lot of the elementary schools use for indoor recess. So it's got some of those fun like songs and dances. And then Cosmic Kids Yoga, which is on YouTube.
I love that you know where everything is and can help families.
There you go.
Help
Well, you can
families.
ask my kids because we try it out at home before I recommend it. And so Cosmic Kids Yoga, it's fun because they tell you a story as you go. And so my favorite one is Betsy the banana. And so you like reach up and you bend over like a banana and then you strike a pose. But there's other ones too. So you've got Elsa and then you reach out in warrior pose because you're sending those ice crystals. And so engaging in the story. And then also they have a mindfulness part of it too. So at the end of the yoga or even just the mindfulness piece, teaching our kids how to, how do we zen? How do we kind of reset and do some of that deep breathing to help ourselves?
Someone just wrote on Facebook, do you have any general thoughts on families who have children with special needs as they continue to navigate COVID-19 and now the upcoming flu season?
And now the upcoming flu. So step one is getting that flu shot when it's available. For children with complex medical needs, it's really been a challenge to get them the services that they need. And so figuring out how to work on that with the schools and with school reopening. So some of my complex kids aren't able to understand social distancing, or maybe they might do things where if their hands are constantly in their mouth, no matter how many times they wash their hands, if they're touching things at school, like that they're at an increased risk of getting sick. And so helping a family with a child like that, or that your child has a weak immune system. And so you're really worried about them getting COVID, like what our plans will be when we go back. And so that's the conversations we've been having with the school districts on figuring out who can go back when, we get the green light to do that, who needs to stay on distance learning or do home hospital instruction. So that's one of the things that we navigate every winter anyways for some of our complex kids. And this year it's really a individualized conversation because it's not only just your child, but if you think about it, anyone else who's around them. And so if your child stays home, but everyone else goes out, they have a risk of bringing it in. And so how do you decide as a family how much risk you're willing to take? And that's one of the things where I can't eliminate the risk. I wish I could, but I can't. And so how much each family is willing to tolerate and kind of dealing with that anxiety as we move into this winter is what we have to address.
Someone just asked on Facebook, what do you do? Do you have any advice for families when both caregivers end up positive for COVID and they're still trying to take care of their child who might not necessarily have COVID either?
Yeah. So if you're sick as a parent and your child is not sick, some families have chosen to wear a mask and kind of separate from their kid. Now, if both parents or caregivers, if you're both down for the count, well, you can't separate from your child depending on their age. So you then need to be able to help them. It makes it really hard because you don't want to then ask grandma to come over to help you, because I don't want her coming over and getting exposed. And so we don't have the same support that you otherwise would have for other illnesses. So that's where some extra screen time, ordering groceries to be delivered, like what do you need to do to just kind of get by? And if at the end of the day, like giving yourself some grace and, have some cuddle time, watch some extra movies, do what you need to do to know that at the end of the day that it's going to be okay. And then if it's not okay, knowing when to call the doctor. And so that's the thing is that if you yourself are experiencing, shortness of breath, having difficulty breathing, like call your doctor. If your child has a hard time breathing, you're worried about any symptoms they develop, or you wonder if they got it from you and you have it, then that's where you need to call your pediatrician so that we can discuss whether or not we need to do testing and give you some more practical advice for kind of how to get through.
Someone is asking on our Facebook page right now. Oh, I just lost the comment. I'm paraphrasing because I can't find it right now on my other screen. But someone was saying, I have a child with special needs. My child has had all kinds of flu viruses, croup, RSV. How do you think my child will react should my child also get COVID-19?
Yeah, so that's a great question, and certainly something that we worry about for those kiddos who are more prone to infection and have had serious hospitalizations. We know that having underlying medical conditions increases your risk of having a more serious COVID infection, and so possible hospitalization there. But we've also seen where perfectly healthy children who get COVID and perfectly healthy children who get the flu also get hospitalized. So certainly trying to protect everyone is really the way that we're going. But I hear that concern. It's something that we talk about a lot for if you do have a vulnerable child, what extra measures. And for a lot of our Charlie Mitchell patients, I gotta say, they're hanging in there because they're so used to limiting visitors and like some of these things where they're like, didn't everyone know to wash their hands? Like they are on it. So keep it up, Team Charlie Mitchell.
Yeah, you know, that it's pretty interesting because when the pandemic first started back in February, March, there were so many families that our public relations team had spoken to, you know, families of children with cancer or children with cystic fibrosis. And the families were like, this has been our world for years.
Yes.
Now you guys are catching up to what we've been dealing with. So it's pretty amazing because obviously everybody's thoughts immediately go to the children who might have immunocompromised systems, but their families, to your point, have been living like this even pre-pandemic.
Pre-pandemic, I mean, they have it dialed in. And if anything, some of our kids who say they have a tracheostomy and they're on a ventilator, like I have not seen children coming in with tracheitis. And normally they come in, there's green secretions, we've got to suction them, all of that. Like that really kind of went away with keeping everyone home. So those kids have not been exposed to other children. They're not going out and they've stayed remarkably healthy. So I'm really proud of our families for taking this seriously and commend them for continuing to do so, even though I know it's getting old for all of us and we're a little tired of it, that it really is working to keep your kids healthy.
One thing I've heard my own friends, other moms worry about was they were worried that when, I'm being optimistic, when the kids get to go back to school, they're worried that they're going to get hit even harder because we have been so isolated. Is that totally unfounded? That because, you know, kids are little incubators. And so that was the fear, that we've been so clean and locked down for so many months that when things do start to reopen, are we going to see spikes?
So I think when we reopen and when we send kids back to school, yes, we run that risk. They're not going to be the same little incubators that they previously were
Yeah.
because school's going to look so different. So talking about masks and how far apart the desks are and all of the other safety measures that are going into place will hopefully also decrease the spread of the normal kid crud. And so fingers crossed. But certainly if your child, you know, once they are back and then they get the, you know, like the common cold, but how do you tell if it's that or COVID? Then that's where, you know, again, call your pediatrician so that we can talk through whether or not we need to do testing or what we need to do to care for your child.
And I heard one other doctor say, can we please stop with the importance of perfect attendance records? So if your child is sick, stay home.
To stay home. Do not give them Tylenol and send them to school so they don't have a fever at school. Like really, we need to take this seriously because, you know, what we see for the ramifications and how quickly it spreads. The other thing that's concerning about COVID and the reason why we talk about the masks and stuff for decreasing spread is that the pre-symptomatic, so someone who's going to eventually have COVID, they just aren't showing signs and symptoms, they still are shedding that virus. And so that's where, you know, especially in the school setting, it's like, oh, you know, and then once the kid's out in the classroom, trying to figure out who was a close enough contact, who also might need to be sent home or who also might need to be tested. So trying to practice with our kids wearing the masks and working on some of these skills so that our kids know just how important it is for when they are back. So we don't have as many absences once they can do so.
I like what you said, just less kid crud, hopefully, when they go back to so we're getting quite a few people asking again about air quality. There might be several people who are watching us right now on Facebook who missed the top of the hour. So if you don't mind, before we wrap things up, just going over again some tips for families when dealing with this horrendous air quality right now with the wildfires all around us.
Yeah. And my thoughts really go out to the families too who have been affected. So, our families and staff who live up in the area who have evacuated. That's a whole additional challenge with the air today. I mean, I look out the window, I can't see across the parking lot. And that air quality, the little meter. So I talked about before how it was like green zone, yellow zone, red zone is like, it's over here in purple, like don't breathe it in at all. Like that's really where we need to be careful and we need to stay inside. So checking to see how bad the air is and whether or not you should really, even be going out to go walk the dog or do things. And so coming up with creative ways for your kids to burn off energy, but keeping them inside so that they're not breathing this.
Okay. And then there is somebody who just wrote advice for parents of students with complex medical needs, medically fragile. As districts, per state recommendations, start bringing back small cohorts. How do you feel about special needs students eventually coming back on site for in-person instruction?
So I'm trying to really tackle that on a case-by-case basis, talking to the family. Just because your child has special needs doesn't mean that they can't tolerate wearing a mask. So some of these families have been working on this. I know that for a lot of our children with autism who are in ABA therapy, that we're writing that into their plan, that please work with your ABA therapist on tolerating a mask. And no, it's not going to be perfect, but can we now get 5 minutes? Can we slowly increase that? So trying to negotiate what that might look like, and then evaluating. So if your child can't wear a mask but isn't riding on the bus, goes in and it's just one teacher versus it's a whole classroom of kids, there's so many different situations. And so that's where I'm really grateful here at Charlie Mitchell Clinic that we have a wonderful case manager and we've been able to call families and kind of talk it through and see both where their concerns are and then also how the distance learning is working. We know some services for certain children don't work as well via Zoom that they do for the in-person being able to do physical therapy. And so trying to tailor it and adjust things as we go, but it's constantly a moving target and we're working on it.
I do have to say on behalf of parents everywhere, I thank you to you and all the pediatricians out in the community, because I can't think of a more patient set of people than pediatricians dealing with worried caregivers. I remember one time when my oldest, who's now 12, I was calling my pediatrician for every little thing. And she was like, that's what I'm here for. And it sounds like you're really open to that communication from your families as well.
I am. I love it. Like I'm a mom. And so if someone talks to me and tells me, like when I'm worried about my kids, like I call my colleagues. So, hey, Dr. Ved, and then she can talk me down or tell me, okay, you need to bring your child in. So I have people that I lean on when I'm in mom mode. And then to be able to be there for our families, like that's where my joy is. Like it is such an honor and a privilege to be, your child's doctor and to provide that support for you and your family. And certainly during these trying times, like, yes, there's more questions, but that's why you have us and that's why you picked your doctor. So have a good relationship with your doctor, know that there's someone that you can trust and then give them a call.
One more question before we wrap this up. I keep saying that. I think I said one more question at least 10 times.
Okay.
So someone's asking, I live close to a fire. I'm inside, but when I'm inside my house, the smell of smoke is still very strong. What are some things that I should do to keep my kids safe, even while inside the home?
Yeah. So I noticed that this morning when I came downstairs, I was like, oh, it smells like campfire now inside my house, where before it was outside. So air purifiers and, recirculating your air and not pulling air in from outside, keeping the doors and windows closed are important things to do. And then if you do live close enough that it is a risk where you might need to evacuate, really looking at kind of that fire map and then being prepared. So there are lots of great resources for what you should have in your go bag and how to kind of plan ahead to have enough of your medications and what you need to be doing. So I think some planning ahead now for if you feel like you might be in that at-risk zone so that you're not caught by surprise.
And there was something I saw online. I think it was from the San Joaquin Valley Air Pollution Control District. They were saying one of the top things you can do too, which I am notoriously bad at, is replacing the air filter in my house. Because you're supposed to replace it once a month, at least once every 3 months. And they were showing pictures of people's air filters that were just like a few weeks, but because of the fires, they were
coated.
They were
Yeah.
coated.
So replacing your air filter, even if you can now find air filters. So I know that they've been, air purifiers and filters are now becoming hard to find. And so knowing that there might be a delay, just like how when I order something online, it's no longer 2-day shipping, that sometimes it takes a little bit of time. So if you feel like your air filter, you haven't changed it in a while, planning ahead so that you can hopefully get one.
Okay, so finally now we can buy toilet paper and hand sanitizer at the store, but now we can get air filters.
Pretty much, yep.
It's always
it's something. Like 2020, this is just a weird year, so there's always going to be something. We'll just keep rolling with it.
You're right. That's all we can do. Like half the time I just sit there with my own coworkers on our team and we're just like, well, nothing we can do about it. So just roll with it. But no, I do appreciate, and I am sure so many of our families, well, they're saying it right now. Someone just said, Dr. Nelson is an amazing pediatrician and such an amazing advocate for all of her patients. We're so happy. She is our girls pediatrician and her joyful persona is so contagious. Thank you for being you, Dr. Nelson. That's from the Kerr family.
Yay. Thank you. Sending love right back.
Well, she's watching, so she's watching.
Awesome.
So thank you again for everything. And thanks so much for your time.
Awesome. Thanks for having me. Take care, everyone.
All right. And for those of you who are watching at home, we do have, as Dr. Nelson mentioned earlier, so many resources on our website, valleychildrens.org /COVID-19. We do also have one now for wildfire support as well, valleychildrens.org /wildfire support. We also have a COVID-19 hotline. You can call 7 days a week, the toll-free number on your screen, 888-286-9336. If you are in the Fresno area, 559-353-3333. And as you heard the good doctor say, wear a mask, wash your hands, stay socially distant, and stay inside. Thank you, Dr. Nelson. Thank you to those of you watching at home. Have a great day.